Good morning. The committee will come to order. I want to thank everyone for joining us this morning, especially our witnesses for taking time to travel here to testify before the committee. Not only has coronavirus caused thousands of tragic deaths around the globe, this public health crisis also threatens the fabric of our economy, which is woven together by small businesses. Already, economists have lowered global forecasts with the dimmest outlooks, predicting a fall from nearly 3% to just 1% growth due to the uncertainty and disruptions inflicted by the virus. Here in the U.S., because small businesses make up over 99% of all employers, we can expect that many will face hardship from this public health crisis. From the local barber shop to the neighborhood cafe to the innovative small tech firm, a pandemic can mean fewer customers, supply chain disruption, and workforce reductions. For the travel and tourism industries, both of which are significant small business job creators, the outbreak of coronavirus is being estimated as the worst crisis since 9/11. In addition to hurting big retailers like airlines, small retail shops, independently owned restaurants, and recreational services are also seeing severe drops in customers. For companies that rely on imports from countries like China, the epicenter of the outbreak, the virus has dried up supply chains, forcing small businesses to reconsider their options for filling orders and meeting sales. Additionally, while businesses around the country take stock of their operational plans during a public health emergency, small businesses may be unable to absorb cuts in the workforce, causing them to scale back operations, ultimately reducing revenue. As the coronavirus spreads, so too does misinformation and alarm. For many businesses, particularly Asian-owned firms, this can be equally damaging. Because of fear, misinformation, and xenophobia, many Chinatown restaurants and stores in my city of New York were already feeling economic pain before even one person in New York tested positive for the virus. Merchants in Chinatown have reported sales drops as high as 80%. Many restaurants and retailers in Manhattan's Chinatown and Brooklyn's Sunset Park and Queens are already having to furlough staff and may have to let employees go. That is why I am proud that the emergency funding bill, which included money for vaccines and testing, will also help small businesses access federal loans if they suffer losses related to the outbreak. This means that firms harmed by the virus could apply for emergency loans with extremely low interest rates to help them meet financial obligations. Just as the SBA helps local economies get back on their feet after a hurricane, wildfire, or earthquake, the agency can be critical to helping our small ventures recover from this public health crisis. In dealing with this public health issue, our number one goal is to contain the spread and ensure that those infected are treated and fully recover. One way to do that is to support paid sick leave. Having people go to work sick only increases the likelihood of transmission and further prolonging the decrease in demand for goods and services that small businesses provide. I look forward to hearing from our public health experts on the health challenges presented by the outbreak. However, we also understand that there will be an economic impact and that small firms will be among the hardest hit. So I look forward to hearing your experiences and concerns. In my view, we should all be focused on preparedness, working together in a coordinated way, and providing accurate, reliable information to our small businesses and the American people. In the end, the stakes are too high, and the federal government cannot afford to get this wrong. I would now like to yield to the ranking member, Mr. Chabot, for his opening statement.
Thank you, Madam Chair, and appreciate you calling this hearing and for your early leadership on this issue. On January 30th, the World Health Organization declared COVID-19 a public health emergency of international concern. On January 31st, Health and Human Services Secretary Azar declared a public health emergency. Undoubtedly, this virus is having an immediate and tangible impact on our nation. In recent weeks, it's become obvious that our economy is not immune to the effects of the virus. We must summon every available resource of the U.S. government to overcome the impact of the coronavirus epidemic on the U.S. economy. Diseases do not know borders, and COVID-19 is no exception. Over the past few months, global leaders have been ramping up efforts to improve international information sharing and cooperation. Last week, the House Foreign Affairs Committee passed the Global Health Security Act, a bipartisan bill that I introduced along with Democratic Congressman Jerry Connolly of Virginia. This bill strengthens our commitment to leadership on global health security and puts in place necessary personnel and systems to respond to pandemics like the coronavirus. As the COVID-19 spreads in the United States, the entire public health service must be operating at maximum capacity to combat this threat. Since 2015, Congress has made strategic investments in public health resources. We increased the NIH, National Institutes of Health, funding by 39%, and the Centers for Disease Control, CDC, funding by 24%. To minimize the impact of COVID-19, it's important to adhere to guidance provided by public health experts, whether it's from the CDC or our neighborhood healthcare professionals. 5 days ago, Congress passed an emergency funding bill to support the administration's efforts in addressing COVID-19. That legislation included $20 million for economic injury disaster loans, EIDLs, serviced by the SBA's Office of Disaster Assistance, which leads the federal government's long-term economic recovery efforts. The SBA's disaster loan program provides numerous direct loan options for disaster victims, including EIDLs, which provide working capital to small businesses affected by disasters to keep them afloat until they can resume normal operations. In this committee, we will continue to consider any proposed assistance strategies to counter the negative economic impact of COVID-19 on America's small businesses. I want to thank all the witnesses for being here this morning. Thank you, Madam Chair, for holding this hearing, and I yield back your time.
Thank you, Mr. Chabot. The gentleman yields back, and if committee members have an opening statement prepared, we would ask that they be submitted for the record. I would like to just take a minute to explain the timing rules. Each witness gets 5 minutes to testify, and each member gets 5 minutes for questioning. There is a lighting system to assist you. The green light will be on when you begin, and the yellow light will come on when you have 1 minute remaining. The red light will come on when you are out of time, and we ask that you stay within that time frame to the best of your ability. I would now like to introduce our witnesses who have taken time away from their families and businesses to be here today for this important hearing. Our first witness is Dr. Jennifer Huan Bui. Dr. Bui is a senior policy researcher and Tan Chair in China Policy Studies at the RAND Corporation. As an epidemiologist with training in clinical medicine and quantitative methods, Dr. Bui research centers on global health strategies and social determinants of health. She received her MPH and PhD in epidemiology from the University of George Washington University and her MD from Peking University School of Medicine. Thank you for being here, Dr. Bui. Our second witness is Mr. Jay Ellenby, the president of Safe Harbors Business Travel in Bel Air, Maryland. His passion for travel began when he explored the world of the U.S. America as a meteorologist. He has previously served as the chairman of the American Society of Travel Advisors, chairman of the Hartford County Chamber of Commerce, and chairman of the Maryland Chamber of Commerce. Thank you for being here. Our third witness is Mr. Andrew Chow, co-founder and CEO of Boba Guys and Tea People USA. And Tea People. He has been featured as a top emerging business leader on CNN, New York Times, Wall Street Journal, Vogue, and NPR. Prior to a career in consumer products, goods, and corporate marketing, Mr. Chow started and exited his first startup in 2011. He has undergraduate and graduate degrees from UC Berkeley. We appreciate you being here today. I would now like to yield to our ranking member, Mr. Shabbat, to introduce our final witness.
Thank you very much, Madam Chair. And our final witness here this morning will be Yinshan Wang. Dr. Wang is a senior fellow for global health at the Council on Foreign Relations. He's also professor and director of global health studies at the Seton Hall University's School of Diplomacy and International Relations. He's the founding editor of Global Health Governance, the scholarly journal for the new health security paradigm. He has published numerous reports, journal articles, op-eds, and book chapters on global health governance, health diplomacy, and health security. He's also authored the book Governing Health in Contemporary China, which was published back in 2014. Dr. Huang obtained his BA and MA degrees from Fudan University and his PhD degree from the University of Chicago. He's been quite busy with speaking requests lately, as you can imagine, so we are grateful that he's able to be with us today, and I yield back.
Thank you. I will now recognize Dr. Bui for your opening statement.
Well, Madam Chair Velasquez, Ranking Member Shavat, and members of committee, thank you for inviting me to testify today. We all know now that COVID-19 is a highly contagious disease that can cause 15% of the infected severe clinical diseases and 1 to 2% of fatality. The first COVID-19 pneumonia cluster was reported from Wuhan, China in December, but in less than 3 months of time, the outbreaks are reported from over 100 countries on 6 continents. Without vaccine and a proven treatment, the only public health interventions is social distancing, to keep the infected and the healthy separated and provide supportive medical care for the sick. China used unprecedented quarantine policies, locked down cities, reduced the air, rail, and highway transportations. By January 29th, all 31 provinces in China has declared public health emergencies during the Chinese New Year. To this day, mandatory 14 days quarantines for travelers are in effect in many cities in China. Outside China, more than 90 countries announced various types of travel bans. How would this impact small and medium businesses? In China, food service, tourism, hospitality, entertainment, and retail industries were suffered most during the holiday seasons. Revenues lost in service sectors during the Chinese New Year week is reported to be 142 billion USD, about 1% of the GDP. It also caused demand shock that's still lingering to today. The small and medium business in China accounts for 80% of the employment in the country. As in most countries around the world, small and medium businesses are the engine of the economy. According to several Chinese surveys in February, about 2/3 of the small business reported that they can only stay open for 1 to 2 months with their current cash flow. Most of the financial pressures are from paying the employees, paying the rent, and the loan repayments. The central government of China has launched several policies to help. The central bank has released 174 billion USD in February to ease the borrowing cost and the funds availability. The interest rate was cut by a 0.25 percentage point to 2.5%. The State Council encouraged the private commercial bank to postpone interest payments on loans until the end of June and to defer the repayment of principal for the time being. It also ordered the large state-owned banks to increase lending to small businesses at preferential rates. The local policy also helps. For example, Beijing government announced the exemptions on some rent payment for up to 2 months, reducing tax and fees for small and medium businesses. However, until last week, only 30% of the small business in China reported reopened. The difficulties they face, including the public health requirement for reopening, the 14 days self-quarantine requirement for travelers and migrants, and a weak market demand, fractured supply chain, and the cash flow problems. So what does it mean to the U.S. business? The global supply chain can suffer from COVID-19. China has the world's major production of chemicals, metals, textile, and electronics. And 7 of the top busiest ports in the world are in China. We are expecting some degrees of supply chain as well as the logistic chain interruptions. The recovery time will depend on how fast China can reopen the factories, and the COVID-19 pandemic will affect the world economy. Although U.S. economy is very different from that of China, I still think there are some lessons that U.S. can learn. I gave about a dozen recommendations in my written testimony on epidemic controls and assistance to SMEs. Here I will only highlight 3. The first one, the SMEs are critical parts of the economy, and financially they are more fragile when the market demand is down. Government should focus on helping the SMEs during the public health crisis by lowering interest rates, defer or waive tax and fees, and easing the lending policies. Second, the health equity issues should be factored into the COVID-19 policies. Having support in childcare, paid sick leave, and health insurance will help promote the safe behaviors during the epidemic. That is, someone who has the mild symptoms or taking care of sick family members can stay at home and obtain proper medical care. This will help separate the infected from the healthy and reduce the disease transmission opportunities. The lacking of these social supports can prolong the disease transmission and in the long term can harm the market demand. And finally, the U.S. government can consider set aside additional funding for unemployment insurance payments to help SMEs avoid bankruptcy or help the creditors of the bankrupt SMEs. And with that, I will conclude my summary. Thank you for your time.
Thank you. Mr. Allenby, now you're recognized.
Good morning, Chairwoman Velasquez, Ranking Member Chavez, and distinguished members of the committee. My name is Jay Ellenby, and I'm president of Safe Harbors Business Travel, and also a veteran of the United States Navy. Since 1985, Safe Harbors has served a diverse range of client companies, organizations, and individuals throughout the world. I'm also here on behalf of the American Society of Travel Advisors, ASTA, the National Trade Association for the Travel Agency Industry. Travel agencies are responsible for the sale of the majority of airline tickets in the United States and are the primary distributor of cruises and tour packages. A full 98% of travel agencies in the U.S. meet the Small Business Administration definition of a small business and are 2/3 owned by women. At Safe Harbors, the past few weeks have been among the most difficult our agency has faced since 9/11. Our clients' response to the current crisis ranges from business as usual, not many, to limiting travel to the United States, Canada, only to stopping business travel completely. Sales are down across the board. As of last week, our 2020 sales are down 20% year over year. We are seeing a 37% decline in international travel, and that is worsening by the day. We expect March to be devastating and are preparing for a 50% year-over-year decline. For April, we can only hope. Yesterday, we laid off a significant part of our workforce, and yet still with tremendous uncertainties ahead. In preparation for this hearing, ASTA surveyed its members about the impact that coronavirus is having with their business. 90% of clients are concerned about international travel, while 72% are concerned about domestic travel. 98% of respondents expect the crisis to have a heavy negative impact on the business this year. 98% also expect a negative impact on business revenues, with 27% expecting a reduction of 50% or more. If I can leave anything with you today, this is the most significant piece of this survey. 22% of respondents report a risk of going out of business in 3 months, and 25% within 6 months. Up until last week, layoffs were in the planning stages. Layoffs are happening in large companies, or large numbers by my company and others similar to mine. I understand some agencies have already shuttered their doors. In closing, I want to take this opportunity to provide some suggestions for what Congress and the administration can do to help our industry during this crisis. Access to SBA loans. We are pleased to see that the recent supplemental appropriations bill included funding for the SBA to provide about $7 billion in loans to businesses impacted by the outbreak. We ask that you consider additional funding if the situation worsens, and that you work with the SBA to relax some of the collateral requirements for these loans. Travel agencies are a service business. They don't have as many physical assets as, say, manufacturers. In the past, travel advisors were forced to put their homes up for collateral in order to qualify for similar loans that were given out after 9/11. So it is essential for these loans to be accessible for small businesses that desperately need them. Number 2, economic stimulus package. Please remember and include small businesses in any proposal for an economic stimulus package. Regardless of how long this crisis lasts, we feel strongly that the federal government should take quick action on this front. Financial aid packages have been given to other struggling industries, and the hysteria and misinformation from many areas surrounded by COVID-19 that continues to plague our businesses shows no sign of stopping. If the trend continues, as the members are reporting continue, we project the loss of revenue for our industry could exceed $7.7 billion this year alone. On Friday, White House Economic Advisor Larry Kudlow confirmed that the administration is considering timely and targeted federal interventions to help workers, businesses, and industries most vulnerable economically to the outbreak. While it's important to include relief for our airline and cruise line partners in such a package, we respectfully ask that you consult with and receive travel agencies' input on any such package to ensure that it will help them weather the storm and be in a position to serve their clients once the economy rebounds. Thank you again for the opportunity to testify today, and I'd be happy to answer any questions you may have.
Thank you, Mr. Allenby. Mr. Chow, now you're recognized.
Good morning, Chairwoman, Representative Velasquez, Ranking Member Chabot, Congresswoman Chu, and Congressman Kim, and distinguished members of the Committee on Small Business. Thank you for the honor of providing testimony before the House Committee on Small Business, although I wish it were under different circumstances. So my name is Andrew Chow, and I'm here on behalf of the small business community and over 20 million Asian American Pacific Islanders, what we call APIs, who call this country home. And I'm the son of immigrants. My dad, a refugee from Guangdong, China, and my mother, a daughter of a Taiwanese Air Force pilot. I grew up 3 hours north of here in Woodbridge, New Jersey, where we ran the only Chinese restaurant in town. My family eventually moved to San Francisco, where we started another restaurant in Fisherman's Wharf. I'm what you would call a restaurant brat, growing up around stoves, duck sauce, and sesame oil. After a decade in corporate America, I myself came back into the food business, opening a chain of cafes and restaurants specializing in boba milk tea and Asian-inspired snacks. My story as a small business owner is fairly common. 2 million of the 30 million small businesses in America are API owned. Small business is interwoven into our culture. Growing up as perennial outsiders, we sought refuge and built businesses across Chinatowns, Japantowns, and other ethnic enclaves scattered throughout the country. And even if you didn't grow up in these enclaves, I'm sure many people, including those of you in this room, have stumbled into a Chinatown noodle shop or Korean barbecue shop at 1 a.m. You can. That was me last week. You can count on those establishments to be open late and bustling, often run by first and second generation immigrants, hustling to make ends meet, chasing what was once the goal of every immigrant in this country, the American dream. This dream and the small business culture embedded in the fabric of today's society is at risk today. Our community usually prides itself on resourcefulness, self-reliance, and grit. So it's telling that we are asking for assistance during this crisis. I'm sure you've all read the news. Chinatowns and other AAPI enclaves across America are facing a drastic decline in patronage. A recent New York Times article said that business is down as much as 70% due to the coronavirus COVID-19. Sadly, most of this is due to misinformation and overblown media coverage depicting the virus as an Asian disease. This virus has no color. It has no ethnicity. It has no borders. COVID-19 is a respiratory virus, but it is fast mutating into social virus, xenophobia, xenophobia, and marginalization of American citizens. I know this is a committee on small business, but the negative stigma of this virus will impact our community long after COVID-19 is gone. We learn every day about attacks on AAPI simply because of our physical appearance, but that is a topic for another day. The mission of this committee is to protect and serve the interests of the American small businesses. As a board member of National ACE, a nonprofit serving AAPI-owned businesses, we estimate that small businesses usually carry about 2 to 3 months of working capital. So as we enter the third month since the news broke, many businesses, particularly those in these enclaves, are holding on for dear life. They do not have sufficient cash reserves to weather this storm. The economic hardship on each of these business owners then trickles down to the labor force, as many are letting go of their employees to cut costs. The destabilization of labor and discretionary income will have ripple effects throughout our economy. In addition to influencing consumer sentiment, COVID-19 has also affected the global supply chain. My business uses ingredients from all over the world, from Japan to Taiwan to Thailand. Anything that is important from overseas is delayed over a month or indefinitely in cases where the factories have shut down. I've heard from many people throughout the country that their businesses are facing similar issues. Banquets are canceled, ingredients are delayed, and sole proprietorships like photographers, musicians, and anything tied to hospitality and events and entertainment are affected too. We say small business is the backbone of the American economy, but what happens when the backbone is fractured? I say this on public record as a testimony not just for COVID-19, but for all future communicable diseases that stall economic productivity. Today, the small business community and APIs, we need help, and one day it will be another community. What makes our country so unique is that we got this far despite our differences, and we learn how to bridge our various cultures and take care of each other. As a millennial, I hear we don't really talk about the American dream anymore. As I understand it, and I had to Google this, the American dream is to live richer and fuller life, enabling opportunity in according to ability and achievement. I believe your recent disaster loan relief bill breathes new life into that dream. And the American dream is alive and well. I believe that. But we just have to remember that enabling opportunity is not always about opening doors. It's also removing barriers. We need more help like the loan assistance program so that our small businesses and our communities can thrive again. The loans give us enough runway to adjust to the changes in the marketplace, even if it is caused initially by misinformation and unwarranted stigma. We as a community are confident that your committee will pass other pieces of legislation to show the world that American small businesses embody the values that built this country: grit, resilience, and helping our neighbors. Thank you for your time.
Thank you, Mr. Chow. Dr. Huang, now you're recognized for 5 minutes.
Thank you, Madam Chair, and thank you, Ranking Member Mr. Chabot. Well, we know that the COVID-19 that originated in China is continuing spreading rapidly worldwide. And if we adopt the WHO definition on the pandemic, it is very clear that all the conditions have been met to declare the outbreak a global pandemic. But that doesn't necessarily mean the virus becoming more dangerous. In fact, according to the WHO, the case fatality rate is 3.4%. That very likely has been heavily influenced by developments in China that has more than 83% of the COVID-19 deaths. If we adopt the South Korean data, which allows us to give a more accurate and optimistic picture of how lethal the virus actually is, the mortality rate is actually just over 0.6%. That is close to the mortality rate in other parts of China. That is the parts of China excluding Hubei province. So the virus is not as lethal or virulent as we thought. And with more cases being found, we expect the case fatality rate is going to be lower. And also, keep in mind that only 81% of the cases actually are mild. And COVID-19 deaths also increase with age, with virus most seriously affecting older people with pre-existing health problems. So in that sense, this virus falls in the category of what we call the dread risk. That is, they are high profile, but pose a lower aggregate risk to human death. So what is the impact of this dread risk? Well, these dread risks could encourage alarmist approach that can elicit a disproportionate level of fear among the population that may distort government and public response. It can lead to calls for government to undertake more aggressive actions in confirming cases, isolating patients, and tracking down close contacts, even though the effectiveness of these measures is still subject to debate, and the cost of implementing these measures can be immensely high. That we have seen in China when they implemented those measures in Wuhan and Hubei province and beyond. And driven by panic and fear, countries pursuing aggressive domestic containment measures may also prompt other countries to impose stringent restrictions on travel and trade. That we have seen in Italy. Unjustified documentation had been requested from importers of aged cheese in Greece, lettuce exported to Poland, fruit to Kuwait, while Italian-grown apples are refused by Ukraine. And many of those measures actually instituted in the outbreak can also be sticky. That means they're not so easy to rescind once they are instituted. China, for example, did not lift its ban on pork products from Canada until November 2009, 4 months after the H1N1 swine flu activity declined in most countries. And also, government and public responses informed by fear can cause huge damage toward economy. If the COVID-19 pandemic lasts more than a year, those 3 C's, coronavirus, crude oil, credit shock, could lead to widespread business failures, mass unemployment, and may lead to, through the entire world, into a global recession. So what should we do? I think it's very important we adopt measures to be proportionate to the actual risk posed to our society. Rather than focus solely on emergency mobilization, it is equally important to emphasize prevention, precaution, and risk management by politically neutral professionals. In that sense, washing hands actually more effective than wearing masks, because the mask, while as an instrument of protection, self also is a symbol of panic and fear. It is also important that the U.S. considering rolling out a strategy that aims to slow down the spread of the virus in the community and minimize the societal and economic impact of the outbreak. So a mitigation-based approach when the virus especially become incontainable would be a preferred approach. Thank you.
Thank you, Dr. Huang, and thank you to all the witnesses for the incredible and important information that you have shared with us. Mr. Chao, I would like to start address my first question to you. I represent Chinatown, both in Brooklyn and Sunset Park in Brooklyn and Manhattan. I have heard that discriminatory rhetoric and outright racist anti-Asian sentiment are a couple of the reasons business is down around Chinatown in my district. If this is something that has negatively affected your business in New York, San Francisco, Los Angeles?
Thank you for the question, Representative Velasquez. I believe our business, for the record, has fluctuated, has been down in some stores, especially those located around these ethnic enclaves. So we have a store, I think, in your district around the Lower East Side. I think that one is flat at this point. I think the community around us, including a lot of my friends, I'm sure you've seen some of the New York Times articles, including, I think, my friend Wilson Tang, he runs Namwa Tea Parlor. I think there's a lot of misinformation where they put the face of coronavirus as Chinese restaurants or Chinese patrons, and that is leading to this larger scare in your districts, as you said. I have seen that personally, also to a lot of our places in LA, in Chinatown as well. Not that we have a space, but we were just in Koreatown, as I said earlier, and I've never seen Koreatown so empty. And I hear a lot from our friends who own these establishments that they've also faced, I would say, some form of discrimination and stigma.
Thank you. Dr. Bui, you're quoted saying that we often see epidemics of rumors, conspiracies, and discrimination coming from outbreaks like this. How can we ensure that facts and science prevail in global health crisis?
Thank you. So I always say that with the epidemic of disease, there's always another two epidemics, that is disinformation and discrimination. So in order for us to fight all three epidemics, I think that the facts that in the social media, in the public is very important. If we have the facts in the public area, have an efficient risk communication plan, then we can fight the disinformation.
Thank you. Mr. Allenby, consumer spending is at the heart of the U.S. economy. How long can those small businesses in the travel and leisure sector survive with businesses conferences being canceled and more people staying at home?
My sector of the business is corporate travel. So we service corporations that travel to such events, conferences, and they have literally shut down everything, certainly for March, certainly for April. And we do not see any kind of life at the end of the tunnel when it comes to the corporate side. When it comes to the leisure side, vacation-type travel, when messaging goes out about the cruises, taking cruises, not to take a cruise, maybe you should take a cruise. If you're older, younger, it's very, very difficult for any agency to remain in business when such messaging goes out. So to answer your question specifically, there are many agencies right now that are shutting their doors as we speak, and some of them will be closed within 3 to 6 months.
So thank you. Dr. Huang, what is the potential impact on low-income households if they are forced to take long periods of work to contain the spread of the virus, and how can we protect their financial stability if they get infected?
Thank you. I think if they take sick leave for too long, then many of this is going to affect certainly the small businesses because they can't afford doing that. Unlike the big business, they don't have this room to maneuver and the resources to mobilize. And if this absenteeism continued, we expect also the country's the food and fuel supply also will be affected. That is going to deal another blow to the economy. So I think it's very important that the U.S. considered a national approach to the issue of sick leave. Maybe after when they used up their sick leave, it's time for the federal government to foot up the bill. But in doing so, we should find an approach to protect both the workers and the business owners.
Thank you. My time has expired, and now we recognize the ranking member, Mr. Chabot.
Thank you, Madam Chair. Dr. Wong, let me go with you first if I can. We know that the official Chinese data can be unreliable. Should this impact the global response to the virus? Do you take that into consideration as you're studying this, or could you comment on that?
Oh, absolutely. I think it's when we are making public policy, it's very important that we do evidence-based decision-making based on reliable, trustworthy data. So if the data actually shows there's actually for example, a higher mortality rate. That is what we found, for example, in Wuhan. Well, that is was sort of what may have something to do with the issue of the quality of the data, but also have something to do with the draconian measures that have been undertaken without advanced planning. So there was a huge probable number of deaths was caused by those draconian measures, and the health system being overwhelmed by those huge demand for testing and hospitalization. So the WHO mortality data has been actually heavily influenced by the data in China, because that mortality, China contribute to almost 3/4 of that, more than three-quarters of the mortality worldwide. So that probably give us this false sense this is a very, very dangerous type of virus. And in fact, if we adopt even the WHO mortality rate of 3.4% based on the current population, and we adopt this prediction that 20% of the population will be infected, we are going to expect 100 million deaths worldwide.
Thank you very much. Dr. Bui, I'm going to go to you next if I can. You had mentioned social distancing as one of the main ways to perhaps deal with this. Would you kind of describe in detail what you mean by that for anybody that may want to follow up with you?
Sure. Social distancing, in principle, is basically separating those who have infected with those who are not infected. So we could see patient isolation is one of the typical of such policies. So as soon as someone is suspected or confirmed patients, one thing they should do is be put at a distance with people who are healthy. So this relates to the hospital, how we design hospital triage so that we know that the cases, infected people can be separate from those other people who are not are healthy. Quarantine will be an extreme measure policy on that because it's quarantine basically asks everyone, including those who are healthy, to stay put, not to move. So between these two, there are many variations of using protections and different types of policies that's in this line. But this is the only thing we have now.
Thank you very much. Mr. Ellenby, you've been in the travel agency business a while now. What advice would you give to those? It's pretty stunning what you said about 22% of them could literally be out of business, within 3 months. It's very disconcerting, shocking, and are there any advice that you would give folks to avoid that?
Thank you for the question. Yes, I've been in the business for quite a while and have seen it all, I suppose. Mm-hmm. Everything from 9/11 to downturns to other diseases. And ASTA, the American Society of Travel Advisors, does a really good job in getting the word out, the information out, and how to address such situations. And unfortunately, there are very, very painful decisions you have to make, such as I mentioned yesterday, that we had to perform layoffs. And depending on the size of the company, if they have the ability to do that, many of the members within ASTA do not have that type of workforce. And in some cases, they're under 5, maybe they're 1 or 2, maybe 3. And so it's very difficult for them to address those immediate expenses. So labor is the critical piece.
Thank you. I'm almost out of time, so I want to get one last. Mr. Chow, how are you communicating with your staff, with your employees about what you're facing and how you're trying to deal with it? And I would assume avoid, people losing their jobs as much as possible. What are you telling them? What are you doing?
Thank you for your question. We just had a team meeting before I flew out to address this. I think the one thing that would help mitigate some of the scare is to give more information as much as you have. So I recommend that for any business owner. So we actually had a team meeting where we said, well, here are the options. If the city where we're from, San Francisco, does go under a full quarantine, here's what would happen. And if not, here's what would happen if it was a partial kind of shutdown. And so we walked that through our managers, and we kind of gave them kind of a realistic idea of what could possibly happen. And I think they took it really well. And I think that's where I think a lot of small businesses across America should start doing that because the washing hands and all of the other preventive measures are already out there. Now we're just getting into scenario planning.
Thank you very much. My time
Time
expired.
has expired. We recognize Ms. Finkenauer, Chairwoman of the Subcommittee on Rural Development, Agricultural Trade, Entrepreneurship from Iowa.
Thank you, Madam Chair. I appreciate being here today, and thank you all for coming all this way as well. I know you guys have a lot of demands on your time right now, so it means a lot that you took this to be here. I'm from Iowa. We actually, today, we now have 8 Iowans that have tested positive, and it's something, my biggest concern is obviously the health and safety of my constituents and Iowans and folks across the country. I know our office, we've been in touch with all of the hospitals in the district personally as well, making sure that we are keeping that line of communication open, hearing what people need, making sure that we're providing that. And I think that's one of the things that is going to be most important across the country, making sure that those lines of communication are open and that they're getting to the right resources. One of the other things that is then, next on my list after health and safety is our economy in Iowa and across the country as well, and how our employers are doing, as well as our employees who, devote so much of their lives to making the world go around in Iowa and across the country. And so I was happy, last week we were able to pass the emergency loans to make sure, $7 billion in emergency loans that the Small Business Administration would be able to provide with businesses being affected. But I do have more questions for the Small Business Administration. I know you guys are not able to answer those, but I figured maybe the best way to do this would be kind of tell you what I want to know from them and then also how it would be affecting you. So one of the things that I want to know is making sure, that we are getting this information out to people across the country and to our small businesses, and how are we ensuring that that is happening? And so I know Mr. Chow and Mr. Allenby, you guys are on the front lines of this, working with small business owners across the country. And what have you seen so far as the outreach, and what could we be doing better?
I'll make mine pretty short. So there's right now, I guess in the age of the internet, a lot of the small business groups and network is online. So I can name a couple that we're part of. Prior to this this hearing, I solicited some of the network from Asian Hustle Network. It's called AHN. There's another set of LinkedIn networks that we have. And so there's a lot of these Facebook groups that we've been talking about. What are you doing? And so in each of these big metropolitan areas, there's also localized versions. There's Chamber of Commerce's. There's other versions of the Chamber of Commerce's online. So I would recommend the government generally tap into some of these key stakeholders, a part of each of these big networks, and disseminate information. Being at this hearing today, I think, is a major step toward that.
Yeah. What about you, Mr. Allenby?
Yes, thank you. Absolutely, the trade associations
Yep.
is a perfect way to get the information out and also solicit feedback. Certainly, chambers of commerce as well. So I agree with both areas.
Okay, great. And then the other thing, I know, again, we passed that $7 billion, but how, this is the question for a Small Business Administration, is how quickly can we get that out to the folks who need it? But my question for you then is, how quickly do you need it? Yesterday, I know, but.
I would love to answer it yesterday.
Yes.
Yesterday. And I also want to preface what I mentioned in my testimony was that easing the regulations for collateral.
Yeah.
So I think that's a very, very careful area.
Okay. That's helpful. Mr. Chow.
I just second that. I think we were talking before this that many of these small businesses are already on kind of their last leg on their working capital. So it's been months, 2 months at least for some of these businesses. So sooner the better.
Yeah, and with that, I know the big thing for me too is making sure this is getting out to folks so that when we have employees that need to have time off, they're able to do it and they're able to get their paychecks. And it's just incredibly important. And these are the types of things that need to be thought about, again, all across the country. So I'm grateful that you guys are here having those discussions. And I hope the Small Business Administration, I'll be also reaching out to them with more of these questions. But I want to know, are they reallocating employees, making sure that there is more for the bandwidth to be able to handle appeal these loans and get them out in a timely manner, and what are the contingency plans for all of that. So I think there's a lot we need to be doing, following up, making sure these are getting out the way that they are, because I know just hearing your testimony today how important this is. So thank you for being here, and I know we all still have a lot more work to do. So thank you.
The gentle lady yields back, and I would like to share with you that yesterday we reached out to the Small Business Administration. We requested for them to put on their website all this information, but also every state has to work with the SBA to declare that they have an emergency in their state, and that will open up the process. Perfect. And now we recognize the gentleman from Oklahoma, Mr. Hearn, ranking member of the Subcommittee on Economic Growth, Tax, and Capital Access.
Thank you, Madam Chairwoman, Ranking Member Shabbat, and the witnesses for being here today to talk about this very important issue. While we've had just a minimal impact in Oklahoma, I believe 2 confirmed cases now, this is still significant, what's going on in the industry. Being in the restaurant industry my entire life, I've had a lot of friends who have called and are very concerned. And according to the American Hotel and Lodging Association, they're estimating right now our annual revenue loss within a range of 32 to 76 billion, including up to about 100 million per day. Occupancy rates declining to 20% in major markets. At best, daily room sales decline around 15%. Which will result in about 15,600 fewer shifts available per day for room attendants. So obviously significant job impacts there. Mr. Ellenby, given your expertise in this travel industry, can you talk about how these affect, what you think about these effects now, and if you could compare the previous global, you mentioned you've seen it all, and when you've been around the industry, you get impacted first because people usually shut down touching being around other people. Could you compare what's happening right now so early in this process and this coronavirus issue, compare it to H1N1, SARS, and all the other things that have gone on?
Yes, thank you for the question. Yeah, the comparison, it doesn't compare to H1N1. The only thing I could think it compares to is really 9/11 of all the previous incidents. And that was one where we literally had 3 months of shutdown. And we started to see business pick up again in January at a minimal rate. But it does not compare. This is a significant impact. And yes, travel is often the leading edge. On corporate travel, certainly, we know oftentimes way out ahead, maybe 3 months, where the economy is going. And we're in the deep of it right now.
So obviously you have an opinion because it's, when you look at deaths around the world, and a single death is tragic. But when you compare it to what we know in Oklahoma, and our governor just spoke to this on Friday, that so far in this season, we've had 54 deaths from flu and thousands, and we've heard from CDC where we've had tens of thousands of people that have been infected, and hundreds of thousands actually. I think 350,000 hospitalized since October 1. We've had tens of thousands of deaths, and in the United States, we've had 26. What do you attribute that to? Because we're talking about average people and companies that are canceling conventions. McDonald's Corporation just canceled their largest convention they have every 2 years, first time in the history of the company in Orlando, where there's probably impacted at least 50,000 people traveling in for that. Why is that happening?
Yeah, the cancellations are through the roof. In fact, more of our business right now involves cancellations than it does actual revenue. The cancellations, I believe, is through information that's coming out from multiple sources. The media gets a hold of that. They put their information on it as well. And I think with the feedback that we're getting with respect to travelers are if they should go someplace, they want to get back. They want to get back home. And they do not want to be quarantined. So they want to make sure that if they go someplace, they can make it back, and they don't know what's taking place in that particular destination. So I think it's the fear of the unknown, and so therefore, that's why they're making the decision to not go, and that's why companies are afraid to have those type of events outside the area.
So, again, I don't want to put words in your mouth, but having talked to many people in the industry, maybe it's just because of my background, that a lot of folks feel like there's a lot of information that's flowing around that while other epidemics, pandemics have been more deadly, much more deadly than this. There's a lot more fear been put into the communities that maybe made people err on the side of caution, much more so than in previous history.
Yes, you're putting words in my mouth. That's exactly it. That is exactly it. It's just that there's inconsistent messaging. And if there was consistent messaging coming out of multiple departments, if there was consistent messaging that was appropriate, that would translate into those really making decisions on travel at a much more reasonable effort.
Madam Chair, I'll yield back the rest of my time. Thank you so much.
The gentleman yields back. The gentle lady from California, Ms. Chu, Chairwoman of the Subcommittee on Investigation, Oversight, and Regulations.
Mr. Chow, as you have seen firsthand, Asian American communities across the country have been severely impacted by the coronavirus outbreak. In fact, I was shocked to find out 2 nights ago that in Los Angeles, Chinatown, one of the 2 remaining major Chinese restaurants that's capable of having a sit-down banquet, Ocean Seafood, is shutting down as a result of the sharp decline in business as a result of COVID-19. And in my district of the San Gabriel Valley in Southern California, I attended a press conference in February to highlight the impacts of this outbreak on our local restaurants and businesses. That was nearly a month ago, but even then, restaurants were reporting a decline of about 50%. Those impacts have only worsened now, and that's why it's so important that Congress and this committee help those small businesses get the assistance that they need, and that's why I joined Congress member and Chairwoman Velasquez in co-sponsoring the HR 6040, the Small Business Relief from Communicable Disease Act, and fortunately, key provisions of this bill was included in the emergency supplemental appropriations package that passed Congress. It was signed into law last week. Now, small businesses impacted by COVID-19 will be eligible for SBA disaster loans. But the outbreak has resulted in more than just economic harm. We've also witnessed horrific instances of xenophobia and abuse directed towards Asian Americans for no reason other than their appearance. These incidents rely on harmful stigmas and stereotypes that threaten to far outlive COVID-19 have even been repeated by members of Congress. And in the last small business hearing, I held up a fake flyer that had the actual logos of the WHO and the County of Los Angeles, actually naming 5 Asian businesses that people should avoid because of a man that they alleged had coronavirus went there. So what, as a business leader in the Asian American community, could you elaborate on the types of xenophobia you've witnessed and discuss what we need to do about it?
Thank you for those comments, and it's a lot to unpack because I think a lot of it is personal, and in the community, we've been talking about this a lot. Unfortunately, both in your district and in so many of the districts we have our stores in, we've seen this psychological impact. People are afraid to go out. Sometimes you can't even know what's going on. There was a recent assault or stabbing in Brooklyn the other day, where an Asian male was stabbed, but they can't tell if it was xenophobia or not because you didn't want to. It was implied maybe, but there's all these uncertainties, and then it's creating communities that are essentially playing their past issues against each other. And I think what we need to do, first of all, is to have better dialogue among anybody who has past been marginalized too. I think it's number one. We need more allies. I think secondly, for those who are going through it, there already are groups that take care of each other. There's a group that I'm on, I think it's called Crimes Against Asians on Facebook, where we actually see every time it's reported, it gets amplified, and then it goes to larger media outlets like nextshark.com or NBC News, and that's actually how we funnel through the pipeline. So there's actually a lot of grassroots efforts. We continue need to do that, and I think that as long as the messaging keeps on getting out and goes through the media outlets, do a better job of storytelling, and we have a better narrative. So, unfortunately, the psychological damage is almost irreparable, because at the same time, you have a 14-year-old, I think, girl in LA recently that was also made fun of and assaulted. It's on the internet, and people recorded this. And imagine she's 15 now. In 10 years, she'll be 25. That she's going to carry that with her, and then that might have her treat certain communities that targeted her in a different way, and it's just a vicious cycle. So I think we need to control all of that.
And could you say how we can address the anxieties within the Asian American community without compromising public health in the business arena? Like, for instance, if your business had to have a worker that quarantined itself.
Yeah, I think we have to separate I think the data, we got to be much more data and do the math on this, is that, the quarantines is very likely, as Dr. Huang said, that somebody may get it in any of our communities. And so at that point, we have to separate that from whoever is getting it and not overgeneralize a certain population. So if that does happen, I'm sure people will take that as a precaution, but I just think people need to rely more on the data and use that versus some sensationalist media message.
Thank you. I yield back.
The gentleman from North Carolina, Mr. Bishop, is recognized for 5 minutes.
Thank you, Madam Chairman. As I listen to the testimony and the questions, I'm struck that we're sort of saying it can be harmful if we underreact. It can be harmful if we overreact. It can be harmful if we react with measures that have unanticipated adverse consequences. So it's a tricky situation that we're in. Mr. Chow, I'm interested. Did I understand that you have retail outlets? That's what your business is?
Yes, that is correct, sir.
And I know that there's a great deal of discussion in media and among government these days of having workers telework. I assume that for a business like yours, that wouldn't be a viable solution, correct?
That is correct.
Because you got to be open, you got to have retail employees who are there prepared to serve the public in those facilities.
That is correct. A lot of people, especially in big cities, there's big companies are having working from home, but that is very hard to do when you're retail based.
And so, and I would imagine there are a lot of small businesses to whom that situation would apply. They need their workers at their locations, right?
Yes, that is true.
There's a good bit of discussion about allowing paid leave, or maybe the government funding paid leave. If that were done on an indefinite basis, for example, that also might undermine a small business like yours, wouldn't it?
That I'm not really sure what the ramifications are. I've heard of different pros and cons of having paid leave. I generally, I think, have been on the side of having the FMLA, for example, doesn't cover a lot of these instances. So like extending that may help. In my mind, my job is to make sure that our workers are safe and that they're most productive. And so if they're constantly worrying and not being their best self because they're worried about a paycheck, I think it actually, in the long run, hurts them. So I think having some type of security would help alleviate that.
If it were available essentially without condition, so that it just deterred your employees from coming to work, under those circumstances, if you're a small business, there might be some adverse consequence. Would you agree with that?
Yeah, I would agree that there would be some qualifications that would qualify for that. I think maybe
need to be designed appropriately.
It has to be designed. It has to have the right rules. Otherwise, if you're inferring that it might get abused, I think that is definitely possible. I think we need to have the right checks and balances for a larger solution like that.
I wonder if it's obvious to everybody on the panel that it would be wrong and counterproductive for anybody to exploit the situation for political advantage by either provoking panic or unreasonably undermining confidence in public authorities' responses, or even by attributing false motivations to public or private responses. What about you, Mr. Chow? Would you agree with that?
That I don't have an opinion on. I think that might be a little too complicated. I'm just a businessman, but I would say I think I would like to think that people are not politically motivated on something that's like a public health issue.
I would hope so, too. I think that's good enough for me. Thank you, Madam Chairman. I yield back.
The gentleman yields back, and now we recognize the gentlelady from Kansas, Ms. Davis, for 5 minutes.
Thank you, Chairwoman Velasquez and Ranking Member Shabbat, for calling this hearing today. The first confirmed case of COVID-19 was found in the Kansas 3rd Congressional District, which I represent, this past weekend. And thankfully, the person who got sick did everything right to help contain the spread of the disease. But even still, there are preventative measures that are being implemented in Kansas and all over the country, as we've heard, to help mitigate and contain this novel coronavirus. These precautions are incredibly important for public health and safety and have to remain our priority. But we cannot overlook the impact of this epidemic on our economy, and especially the small businesses, such as those who are here today, and those in the district that I represent, which are the backbone of our communities, really. I've already heard from small business owners in my district who are worried. One shared a fear that this would not only jeopardize her business's future, but would jeopardize her ability to pay her bills, cover her rent, get her groceries. And crises like these can be especially tough on small businesses. Small retailers and restaurants don't have the teleworking options for their employees and disproportionately suffer when sales slow down as folks start to stay home. So my first question is, because this coronavirus has just reached the Kansas's 3rd district this weekend, and we expect that there will be more cases, no one can be sure what the full impact is going to look like. I want to know what you think I should be doing to help the small businesses in my district prepare for the effects of lower sales or sick employees. Mr. Chow, I'd like to start with you.
Thank you for your question. I think it goes back to what we've been saying. A lot of it has to do with communication. The bill that has passed, that loan assistance would definitely help in getting the right information to them and getting them involved if that applies to their business is number one. Number two, I think there's a lot, I would say, of community support. I think you're seeing right now a lot of communities banding together and saying, I think there's a hashtag called Support Chinatown. So I think that if that could happen in your district, people, I think, realize that especially if there's not as many cases in your specific area, and it is a little bit more of a over stigmatization and generalization, supporting local businesses has really been helping certain areas. So I think that's probably a campaign related to that helps. And I think third is just anything that helps, whether it's certain other programs that helps with financing or capital, or just other things that having rent or expenses be deferred. I think that's a big one. I think I've been reading some of the certain businesses. I think a bunch of us want to band together where we make a statement where we say, landlords, please provide some relief, and just going to landlords directly. And I think having that come from legislators or parts of the government might also help, because it'll show solidarity.
And then just I would love to hear from other folks on the panel. When you talk about the information that I can be putting out, we definitely have on our website information from the CDC. We also have information from our local county governments and the state government. Is there any particular way that you think that our office should be either doing outreach or taking in information from just from the people who are on the ground who are dealing with this day to day?
My recommendation is that we need to understand when people are in doubt, are having fear. The first thing that will harm their the information is that if they have suspicions of the government, or they don't trust the government can handle it. So I think the transparency is very important, that whenever there's a case, that there should be reported in time. So transparency is important. And the other thing is the competency, right? So if we know that there are testing sites, there are treatments ready, those information need to be ready for the public.
Thank you. And it sounds to me from from those of you who have been studying this and directly feeling the impacts of this, as though we need to make sure in our congressional offices that we're sharing information with folks, being as transparent as possible, and then those of us on the committee need to make sure that we're helping to support our small businesses, whether it's through programs and adjusting some of our loan programs and the collateral requirements. I thank you for your testimony today, and I yield back.
The gentlelady yields back, and now we recognize the gentleman from Florida, Mr. Spano.
Thank you, Madam Chair. And thank you to each of you for being here today. We appreciate you taking the time to come up and speak with us. I'm sure we probably all have our individual examples. I was just at an event on Saturday, Friday maybe it was, where I had a good friend of mine I've known for a very long time. They own a travel business, and she was just almost, crying about where they were at. They had a trip scheduled to Italy that had been canceled the day before. Trip to D.C. this week that thankfully had not been canceled, but the implications for her and her family were pretty significant. And this is a business where the business is them, her and her husband, right? So it really has turned people's lives upside down, which is incredibly unfortunate. But one of the questions that she had for me was that she was concerned about the folks who had booked trips through her company. They'd been canceled, but there was no recourse for them. Even potentially the insurance policies that they had purchased were not paying out because, I guess, of the language in the policy itself. So I'd like to ask Mr. Ellenby if he could speak to that for just a moment. Are typical travel insurance policies covering this scenario?
Thank you for the question, and sorry to hear about that particular situation. Not all insurance policies are the same. Some do not cover it, some do. I don't have specifics on those particular programs. We can certainly provide that. But I can tell you is there are many suppliers who have become very liberal in their policies. And so working with the suppliers, they've done a very good job in responding to any kind of cancellations, refunds, and working with the travel agent to support the client.
So what would you recommend someone do if they're in that specific circumstance? How do they petition, I guess, the venue or whoever might be giving them a reimbursement?
In that particular case, I would recommend that the agent, a friend, speak with their supplier and continue to speak with that supplier if they don't get the correct answer. And I'm sure the American Society of Travel Advisors could help out in that case as well.
Great, thank you. And you had mentioned in response to a question a moment ago that the only thing that you could really liken this scenario to is the 9/11 tragedy, and it took 3 or 4 months before things even began to move again. So I know it's hard to say because we really don't ultimately know how significant this is all going to play out, but what's your best guesstimate, typically in this type of scenario? Do you think will our agents, let's just say, for example, I'll give you this, let's say things begin to improve beginning in May or June, people began to feel comfortable booking trips again. Will the travel agencies make up for what they've lost in part? Will people travel more over the summer because they haven't traveled in March and April, or is it just lost opportunity?
That's a great question. Thank you for asking that. You like to think there's pent-up demand. Mm-hmm. You can only hope there's pent-up demand, but I think I would say for the most part there is probably lost opportunity. Mm-hmm. There is lost opportunity. I doubt it's going to be made up through the rest of the year. Very doubtful.
Yeah. Thank you. Madam Chair, I yield back the remainder of my time.
Gentleman yields back. Now we recognize the gentleman from New York, Mr. Delgado.
Thank you, Chairwoman. I appreciate all of you being here, providing all of your insights. I wanted to sort of piggyback a little bit, Dr. Bowie, on some of your considerations for policymakers when it comes to supporting SMEs. I thought one of your takes was pretty interesting here. You say that SMEs could benefit from diversifying business platforms, online-based platforms, and virtual service provisions can help SMEs sustain business during quarantines or travel bans. It would be helpful if policymakers could bring tax breaks and technical guidance to help SMEs restructure their business operations. Can you speak a little bit more about that?
Sure. So the data we got from China, some of these are surveys that given to SMEs. Some of those are e-commerce data that it collected, and it shows that it definitely overall retail are hurt, but it's not all even. So the business that has a virtual store during the quarantine and the travel ban, those are hurt most. But at the same time, people are buying groceries or even meals and certainly other supplies through online vendors. And then in China, we also see that the shops that has like no servers shop or even vending machine, which has been here for a long time, but in China it's actually a new phenomena. But we see that all of these machines and human-free shops are getting more traffic, becoming more popular. So online education, online entertainment, and online gyms, those are also seeing increase in traffic. So one idea is that would it be helpful for business to have both a physical shop as well as a online shop, a virtual center? That at least can help the business to keep contact with their potential customers or maintain some loyalty of the customers. I know some businessmen in China during the downtime, they even send free videos to their customers and helping entertain their kids because the kids are home, have nowhere to go. But these are the very innovative ways to help the business.
And I'm assuming, and please correct me if I'm wrong, that you haven't encountered any examples of those types of approaches being incentivized, within the SBA, right? There's nothing you've come across that would speak to this specific issue?
No.
Right, okay, so that's definitely something that I think we might want to look into. I'd imagine that some of the low-interest loans, too, if they were tied to sort of incentivizing companies to diversify in this way could be quite helpful. Dr. Wong, I just want to also bring you into this conversation because I think at the tail end of your testimony, you said that you noted that the targeted loans are helpful, but you also said the U.S. government may consider following the example of Italy to provide tax cuts and credits for small businesses. Could you speak specifically to what you might have in mind when it comes to credits?
Thank you. That is a very specific question. I think, in terms of the credits, I think, they could be taking just different the forms, that it could be tax credit to those who have been suffering during the outbreak. It could also be like the forms like deference of the payment that we have seen also in case of China. But it's
Let me help you out. I think I have an idea. I think maybe we can do a tax credit for those companies that look into diversifying their platforms. I think that could be one way in which we're able to help facilitate this. I think that obviously trying to go about this with clear eyes in a depoliticized fashion is going to be of utmost importance. And just want to again thank each and every one of you for your insights. It's very much appreciated. And with that, I yield back. Thank you.
Thank you.
The gentleman yields back, and now we recognize Mr. Snyder from Illinois.
Thank you, Madam Chair. I want to thank you and the ranking member for having this meeting. I want to thank the witnesses for joining us today and sharing your perspectives, your experiences. We are dealing with a crisis. There's no question about that. It's being dealt with at all levels, in our local communities, at the state level, here in the federal government. Mr. Chow, Mr. Allenby, you were literally at the front lines dealing with this in your businesses. And I think one of the greatest challenges we face especially as policymakers here in Congress, is trying to find the path to help you short-term, how to deal with the immediate impacts it's having on your business. Mr. Ellenby, you said you laid off a third of your workforce?
Not a third, but we laid off a significant amount.
Number. But there's going to be intermediate and long-term impacts on this. And I think, Dr. Brewer, others have talked about this, the transition from trying to contain to now mitigating the consequences of this. And that's why I'm pleased that in the House last week we initiated and we passed $8.3 billion. It passed the Senate, was signed by the President. That was a big step to move forward to help the people at the front lines. We need to continue with that. In my state, in Illinois, our Governor Pritzker issued a disaster declaration yesterday for the state. This allows the state to access those emergency funds, and I suspect we'll see more of that. I also think, and speaking to my colleagues, it's important for us to be the public face, to make sure we're communicating with our constituents, keeping them informed at all levels. Someone else mentioned the challenge we face, because every action we take will have counteractions. We want to make sure what we do is in the right direction and that we are flexible to respond and make decisions today that will have consequences to underlie and support our decisions tomorrow. But there's also things I think we can do that model behavior. The no-touch greeting, whether it's the Mr. Spock, may we all live long and prosper, or it is elbow bumps. There are things we can do, washing our hands, singing happy birthday twice as we wash our hands, changing just general hygiene. It sounds simple, but that is a big step to try to mitigate the impact of all of this, including disinfecting services, desktops, phones, et cetera. And let me just advise everyone, if you don't feel well, please stay home for all of us, and it's critical. But as people stay home, it's hard, and I think this is one of the things we talked about, whether it's unfortunate layoffs or just go home for a couple of weeks. We need to make sure that we are providing two levels, I think, of support. One is the level of income continuity, whether that is paid leave, making sure that those who, whether they're working in a restaurant, a retail store, travel industry, manufacturing, that if they aren't able to go to work, if they aren't able to get their paycheck, we're ensuring that they have the resources to feed their families, to pay their bills, to not lose their housing. That's crucial. The second piece that I think we need to be thinking about, and we've talked some about this with the small business loans, is making sure businesses like yours have the capital to ensure continuity. Mr. Ellenby, I don't know if this is going to be a few weeks, a few months, or take us, some have said this may extend it to 2021. That's going to be real challenges. And for you, it's not just managing your business, but managing what, hopefully, as you said, the pent-up demand. As customers come back, we want to make sure that our businesses are there for those customers and that they're healthy and the employees can come here. We passed the bill last week. Legislation designated coronavirus as a disaster, which opened up the Small Business Administration's disaster loan program. This is critical, but we need to continue to stay focused and be thinking about what is our next step. This is a long-term play. We need to be thinking not just next week, but next month and the month after, and policy. So I thank you. And I've now left only a minute for questions, but I'll open the question. Mr. Chow, Mr. Ellenby, what other ideas, as you've sat here, as you've thought about it, are there other things we can be doing to help small businesses like yours?
I'll be very quick. One of the things that our membership of ASTA, my company itself, we do provide paid sick time and we do provide health insurance, but there are many smaller companies who do not. They do not have paid sick time, and that's going to be a very big issue, so that really needs to be considered in any kind of with loans and stimulus.
Great. Mr. Chow, 14 seconds.
Yeah, I want to echo that. And actually, I just echo that. I think that's been a big topic, just especially with a lot of part-time workforce. A lot of the income continuity is going to be the big thing. And as an augmented workforce becomes normal, we have to figure that out as just a society.
Great. Thank you. And with the 2 seconds, I'll steal over my time. The idea of how do we move forward in this crisis is critical, but learning the lessons so we are better prepared for the next crisis is just as critical. I commend you for offering that paid time off and sick time and health insurance. Everyone in this country should have that. And with that, I yield back.
Gentleman yields back, and now we recognize the gentleman from New York, Mr. Espaillat.
Thank you, Madam Chair, Mr. Ranker. I'm really concerned about the way small businesses are being treated in this crisis, particularly because testing as of yet has been very limited. So as we increase significantly testing across the country, maybe to a degree that you can even go to a local pharmacy and get a test kit, the numbers are just going to go right through the roof. And this will create a long-term crisis for small businesses. And, you know, we saved the banks, we saved Detroit. Now the White House is proposing to save the cruise industry and the travel industry. And yet we want to saddle small businesses with loans. And I support that, and there's 0% loans, but nevertheless, you know, we want to saddle them with debt. And they will be shaken up by this crisis, and then they will have a looming debt at the end of this process, Madam Chairwoman. New York City is offering not only loans, but grants up to $6,000 to those businesses that witness a 25% drop in business. The empowerment zones offered a tax credit to businesses that of $3,000 per employer that hire local. I'm proposing that we offer a tax credit for businesses that have witnessed a 25% drop in business and that retain those workers. In addition to that, I think that we could give grants for example, the installation of smart energy equipment in small businesses that will result in a dramatic drop of 30 to 50% of energy costs. That's money in your pocket. That's help. The rest is saddling you up with debt. I don't see how that's helpful. It may be helpful now, but it will cripple you tomorrow. So I think that we have not helped small businesses the way we should, the way we've helped other parts of the economy, while small businesses are the biggest employers in the country. So we worry more about the banks when we had the meltdown in Wall Street. We worry more about Detroit when we had, you know, the near destruction of the auto industry. And now we're worrying about cruisers and the travel industry, and we're leaving you guys behind because all we're giving you is debt. And debt may be 0%, but debt is debt, and debt is bad, especially if you're weak economically and you can't make ends meet. So my proposal, I want to hear from all of you as to what I'm proposing. There is a model out there already. Do you support a tax credit for those businesses that have witnessed a drop of 25% in business and have retained their local workers? Because this is also about communities. And do you support grants to do the renovation of smart energy equipment that would not only lead to a better environment and cleaner energy, but also to a 30 to 50% drop in your energy bills? Anybody?
Thank you. Yes, yes, and yes. So yes, we could agree to every one of those items. And I would like to offer, I'll be very quick so everybody else can speak. We may have some additional ideas from our trade association that could help you as well.
We'd love to hear from you, those ideas. You're on the ground. You can tell us what can make it work for you. But at the end of the day, it has to be in your pocket.
Yes.
Don't bring me to another breakfast for a loan that I'm not going to qualify for, because if you need a loan, you probably have a shabby credit. You know, you're not able to meet payroll, or you don't have capital to expand. If you have good credit and you meet payroll and you have money on the side, the bank comes to you. You don't need to go to the bank. Right. So if you have additional ideas, I would love to hear them. Anybody else? Doctor?
Yeah, certainly I would support that idea. I think for policymakers, we're not make a choice between maximum protection and minimum disruption. Actually, it's always about balancing this draconian containment measures, including aggressive testing, against these impacts on the economy and the society. We have seen the countries like South Korea, even Italy, as also, while they're taking aggressive testing measures, we've seen actually the number of significant increase of the number of the confirmed cases. But in the meantime, they're also very keenly aware how they should minimize the damage this could cause to the economy.
Thank you.
Thank you.
Thank you, Madam Chair.
The gentleman yields back. And Mr. Allenby, you mentioned that you were working at the travel industry back during 9/11, right? So I would like for you to go back and check, besides the disaster loan program that we had in place back then and that we included in this bill, if there were any other provisions that were part of that 9/11 package that you believe were effective in helping the businesses that you represent to get back to us.
I'd be happy to do so.
Thank you. And so we want to thank all the witnesses for taking time out of their schedule to be with us today. And I would like to thank all the witnesses for educating us on the potential economic and public health impacts of the coronavirus. Moving forward, it is our priority to do whatever we can to help those small businesses that will disproportionately suffer economic harm. But we must also realize this is a public health issue as well, and I encourage everyone to plan, prepare, and to not panic. Common sense measures like washing your hands and seeking medical care if you are experiencing flu-like symptoms will go a long way. And our federal government will play an important role as well. Dr. Bui, I heard you when you say it is important that people have faith in the information that they get from our government. Otherwise, we're going to defeat any purpose. I urge colleagues on both sides of the aisle and the administration to work together on a coordinated government-wide plan to respond to the coronavirus. With that, I will ask unanimous consent that members have 5 legislative days to submit statement and supporting materials for the record. Without objection, so ordered, and if there's no further business to come before the committee, we are adjourned. Thank you. Thank you. Yeah.
Hey, how you doing? Nice to see you. How's it going?
Good. Thanks for your work.
Yeah, what do you think? Not too bad. Interesting discussion.
Yeah.